Kia ora koutou. Welcome everybody to tonight's webinar. I'm Nicola Batossi, CEO of Fertility New Zealand, and it's my pleasure to welcome you here tonight. Thanks for taking the time to join us. Fertility New Zealand is a charity which has been supporting New Zealanders through their fertility journeys for the past 30 years. If you haven't looked at our website before, I encourage you to check it out. There's a really wide range of resources on our website through a number of different topics. We have support groups which run in 12 different centres around the country. They're facilitated by an army of wonderful volunteers who have all been there and know how difficult infertility can be. Most of these groups are meeting virtually at the moment. So please feel free to reach out to us, especially at the moment. Our helpline's still fully operational. You can either contact us via the helpline on your screen or via your regional group. The details can be found on our website. So Dr. Karen Buckingham will speak for about 15 to 20 minutes, her presentation. You can type your questions into the chat box at any stage during her presentation. So you can either ask on the topic that she's speaking about at the time, or you can wait till the end. And there will be a recording available on the news section of our website from tomorrow that you're able to watch. So without further ado, it's my absolute pleasure to introduce to you Dr. Karen Buckingham, who is a fertility specialist at Repromed Clinic in Auckland. Thanks, Karen. Over to you.
Thank you very much, Nicola, and good evening, everybody. I'm really pleased that so many people have joined us tonight. I feel like I've been talking to my computer all day. I can't wait till this is lifted and we can actually meet in person. So I'll do my best to talk you through this topic. I actually invited my teenagers to come and join us. I said this could be their home learning, and they were kind of interested until I told them what the topic was, and then they just looked horrified and ran back to their bedrooms. So hopefully we won't get any interruptions from hungry teenagers. So I've been asked to talk to you about the timing of sex for conception. And so I thought I'd approach it by giving you a bit of an idea as to why timing might be important and when the optimal time in the menstrual cycle is to have sex in order to get pregnant, and then talk about some of the ways that you might be able to work out when that optimal time is for you. And as I said, we'll have plenty of time at the end to ask questions. I will do my best to look at the questions as they're appearing on the screen, but I find it a bit hard to multitask to keep on track and look at the questions. So if I don't answer them during this slide presentation, then I will do that at the end. So without further ado, why is timing important? Sorry, let me find how to... There we go. So it would seem pretty obvious that if we know when we're ovulating in our cycle and we have sex at around that time, we should have higher chances of getting pregnant, okay? But that can be more difficult than we think. And I think in some circumstances that can also give couples a much more of a degree of control. So at the moment, there's lots of things that are out of our control, particularly at this time when, you might want to start treatment or see a specialist and you really can't because we're all in lockdown. So some things are in your control, and if you can, then this might be a way that you can improve your chances slightly. So before we talk about when is the optimal time, you need to have a bit of an understanding of the whole menstrual cycle. And some people are really familiar with this, but I often get asked questions from patients and it sort of, I guess, shows me that actually people may not know when their most fertile time is. So this diagram, I think, illustrates it really well. So let me take you through it. This is looking at a stylized 28-day cycle. Okay, and when we count a menstrual cycle, we count from the first day of one period till the start of the next period. And we're assuming that's, say, 28 days. Let me talk you through what happens in a normal menstrual cycle. So on day 1, we're having our period and our endometrium is shedding. But at the same time, in our ovary, a cohort of eggs are growing, okay? And of those cohort that start, one of them usually will be ovulated. The other ones will just die. As those follicles are growing, they're making a hormone called estradiol. And so you can see here in this orange line, the estradiol levels are rising. In response to that rising estrogen level, our endometrial lining, once we've finished shedding it, starts to regrow and thicken. When that estradiol level gets to a certain level for a certain length of time, it triggers our brain, a pituitary gland in the brain, to send a signal to the ovary called luteinizing hormone, or LH. So our brain sends down this signal. It's quite a sharp peak of LH that signals our ovaries to ovulate. And then ovulation usually occurs about 12 to 24 hours after that LH peak. Once the egg's ovulated, the cells that were surrounding the egg in that follicle turn into a structure called the corpus luteum, and it's now this structure that starts making progesterone hormone. And so you can see here in the luteal phase that progesterone level is high. And the progesterone acts on this thickened endometrium to turn it into a secretory endometrium that's much more receptive for an embryo to implant in. You may have heard of different phases of the menstrual cycle. So in a 28-day cycle, we would say the follicular phase is from the first day of the period until ovulation. And that phase can vary. It might not be 14 days, it might be shorter, it might be longer. That part can be quite variable. And then the luteal phase is from the day of ovulation until the day of the next menstrual cycle. And that's the bit that's usually quite standard, so usually around about 14 days. So when people's menstrual cycles vary from 21 to 35 days, the variability is in this follicular phase, and that's still normal. So getting back to ovulation, once once the egg's been ovulated, it can last for about 24 hours unless it's fertilized, okay? But sperm can survive within the cervical mucus and in the female genital tract for about 3 to 5 days. So that means that we have about a 6-day window each month where we could potentially be fertile. So 5 days prior to ovulation and the day of ovulation. And as you can see in this table down here, this is, sorry, it might be a little bit small for you, but it's just showing the percentage chances of getting pregnant on each day relative to the day of ovulation, which is day 0. So the day of ovulation and the first few days before that are the highest chances of pregnancy. But you can still get pregnant if you've had intercourse even out to 5 days prior to ovulation. And the smaller graph just shows that it is dependent on females' age. So not surprisingly, the yellow line has higher chances of pregnancy because these are the women who are aged 19 to 26, compared to the blue line, which is the woman aged 35 to 39 years of age. All right, so how do we work out when is that fertile window? Okay, it gets a bit confusing, and there are lots and lots of different ways we can do it, and I'm just going to run through those each. So starting with, I guess the most lowest tech or easiest way is sometimes the calendar method or using a fertility app. So in its simplest form, this is just writing down the first day of your period on a calendar and then marking the next day of your next period. And you might do that for a few cycles, and then you can add up the number of days between each of those day ones and average them. So if you have a 27-day cycle and then a 28-day cycle and then a 29-day cycle, your average would be 28 days. And then, as we said before, you'd usually ovulate 14 days before your next period. So in a 28-day cycle, that would be day 14. And so you'd probably want to be having sex anywhere from day 9 to day 15 to sort of try and capture that fertile window. A lot of the apps that you can get for your phones and things now calculate that automatically for you. There's lots and lots of different apps out there. I can't tell you one's better than another. It's really just a bit of trial and error. But you might find that those apps just give you a slightly broader fertile window than just simply calculating 6 days, okay? And that's because they're taking into account that variability between cycles. So that's one of the simplest ways to try. Another method can be identifying the cervical mucus. So again, going back to that menstrual cycle, in the follicular phase when estrogen levels are rising, your cervical mucus responds to that and it becomes thinner and clearer and stretchier, almost like egg white at the time of ovulation. And then in the luteal phase, when progesterone's dominant, that mucus gets very sticky and thick. And so if you were checking your cervical mucus, you'd put some fingers in the vagina and take a sample of mucus and then sort of stretch it between your fingers to see what that mucus was like, and try and work out if you thought it was more fertile mucus or not. This next schematic just shows that a little bit clearer. So if you imagine this is the vagina down here and this is your cervix, and here's the endocervical canal going up into the uterus. These are the little crypts that make the cervical mucus. And on this side, we've got the follicular sort of phase. So you can see the mucus is thin and stretchy, and it's really receptive to sperm and easily penetrated by it. But then on the luteal phase, in response to progesterone, that mucus is really thick and sticky and impenetrable. And so this is the reason the progesterone-only pill works really well as a contraceptive, by thickening that mucus. Cervical mucus is sometimes a tricky one. I found it really hard to use that as a method myself when I was trying to get pregnant. And I don't know, lots of things affect it. So whether you've had sex or had a bath or used lubrication, that can sometimes affect it. And some women find that really just difficult to judge. So don't be too hard on yourself if you're one of those women and you just can't really work it out. It's not the only method we have of checking. Another method could be using the ovulation detection kits. These are very cool. I wished they'd been around quite so readily when I was trying to have babies, because I think this was exactly what I would have used. So there's lots and lots of different varieties around, some really expensive ones that are electronic sort of monitors that you can buy in the chemist, lots of cheaper ones on the internet. And it's really a matter of trying a few really to see if they work for you. But basically, they... let me just turn up the next page. As we said before, just prior to ovulation, you get a peak of this LH hormone in your blood, and then that is filtered through the kidneys and excreted in the urine. So you can also see a similar peak in the urine. And so these kits are designed to try and detect that peak. And so what you need to do is you need to do a urine sample, probably for about, say, 9 or day 10 of your cycle, and every day check a urine sample with your little kit to see if you're getting a peak. And what that might look like is, this is one of the monitors you might see. You do your urine sample on the end there and then wait to read the test result. And so you'll see in this top one, there's only one line showing. And so that suggests that there's no LH surge yet. But when you get 2 clear lines showing, that's suggesting you're having an LH surge. And so that's the time you'd have sex, that day and the next few days. Pardon me. If you get a reading like this one where there's no lines showing, that means that it's probably an invalid test for whatever reason, and you probably should repeat it. LH monitors are really good, really useful in making that window for conception a bit narrower. So, like I say, with the calendar method, you might have to, be trying for 6-7 days. With the ovulation detection kits, if they're going to work for you, you might need to try for 2 or 3 days around that time. You can be much more precise about when you have sex. It doesn't work for everybody. Some people find they never get a positive reading, or they always seem to have a positive reading. So again, it's worth trying a few different brands to see if that's the case. And we'll talk about what to do if it doesn't look like you're ovulating near the end. Okay. I've put basal body temperature charting in here for completeness, but it's not something I'd really recommend. But a lot of people ask about it or have done it. So basal body temperature charting is where you take your temperature at the same time every morning before you do anything else. And that sounds kind of simple, but it's actually really hard. I did this myself for years because I was a bit OCD, and it's a really hard thing. So if anybody ever comes and brings me their charts, I'm always very appreciative of the effort that's gone in, because it's a hard thing to do. To show you why we do it or what it can help with, going back to this menstrual cycle chart again, in the luteal phase, our basal body temperature rises by about 0.5 degree Celsius once we've ovulated. So that's it's a really tiny jump up. So it's not something you're going to feel. You're not going to feel hotter in the luteal phase. You can only detect it by having a really good thermometer. So if you do that, like I said, you have to do it first thing in the morning, same time every day, before you do anything else. So you can't jump out of bed and go to the toilet or have a cup of tea or anything like that. So what you should see is you see this rise in the luteal phase. But the problem with the basal body temperature is that it's useful for confirming that you've ovulated, but not useful for predicting it, because by the time your temperature is rising, If you haven't had sex by then, it's too late. Does that make sense? It's a tricky one. So good to confirm ovulation, and especially if you get a chart like this one, it's really clear to see that you've definitely got a nice cycle there. But in fact, what we tend to see is more charts like this where they're all over the place, and it's really hard to know whether or not, is this the surge here, or is my temperature going up here? It's really hard to tell sometimes. So I don't think they create a lot of angst. So it's not something I'd say you should do. I think there are better ways of checking when that fertile window is. All right. So as I said before, it's really normal for menstrual cycles to fluctuate, and we'd consider it normal if they fluctuated anywhere between 21 days or 35 days. That's very, very normal. So, we're not robots. We don't have 28-day cycles every day. We make our jobs so much easier if people did. So it's common to have, a 25-day cycle one month and then 27 the next, and maybe 24 or back to 26. It's all over the place. So that's why it's important to try and work out where your fertile window is. I should also say, even the most regular of us will occasionally have cycles that are a bit odd for whatever reason. So we see that really commonly in the fertility clinic when someone tells us that they have really regular cycles, and then we start monitoring them and they don't. And that's not a problem if it's only, every so often that happens. But if that's happening regularly, that's when we need to maybe look into it a bit further. So I've just said on here that if you're getting really irregular cycles, so shorter or longer in length than we've discussed, or if you're getting periods maybe less than 10 days after you're pretty sure you've ovulated and you think that luteal phase might be short, come and see us. If your periods are really painful, or you're getting other pains throughout the cycle, or if you're getting any bleeding throughout the cycle, we should see you. And similarly, any unusual vaginal discharge. All those would be signs that you should seek medical advice. Okay, I'm going to talk a little bit about timing for men, because we get asked this question lots and lots. Okay, so for men, they make sperm all the time, and that's made in the testicle and it's stored in the epididymis. And when they ejaculate, it moves through the epididymis and out of the body. And so the more frequently men ejaculate, the healthier is the sperm that we see. So when sperm's sitting for weeks and weeks and weeks in the epididymis, it can be damaged by things like heat and other toxins or free oxygen radicals. So if we can speed the transition through the epididymis by ejaculating fairly frequently, then hopefully the sperm that we see will be better quality. You might hear us say when we ask men to do a semen analysis, we want them to abstain for 3 days prior to that semen analysis. And it's not that 3 days is a magic number or the sperm will be magically better at that time. It's just that when we're doing or comparing semen analyses, we know they've been collected under similar conditions. So that's mainly the reason we get men to do that. So, if you're trying to get pregnant, then we'd suggest you ejaculate fairly frequently, a couple of times a week perhaps, and especially, around that fertile window, sort of 2 or 3 times. Someone's asking, is it better to have sex multiple times a day versus once a day or every second day? I don't think there's any evidence about which is best. Multiple times a day might be exhausting for some of us, so you might, it all depends on what, there's nothing wrong with doing that if you wish to, but I can't say that's going to be better than someone having sex, every second day throughout that window. Okay, there's millions of sperm that shouldn't matter. All right, talking about sex some more. So as I said, regular intercourse 2 or 3 times a week, sort of soon after your period finishes until after that fertile window, should ensure that the sperm quality is optimal and you're having sex within that fertile window. Some people worry about the lubricants that they use. There's been some studies in the laboratory that have shown that some lubricants can impair the movement of sperm, but there aren't such compelling evidence for studies of that actually happening in the body. So if you're really worried about that, maybe use a lubricant that's thought to be a little bit more friendly for sperm, like pre-seed or mineral oil or canola oil. Okay, those have been shown to have less effect, but I think the effect of those is probably small. It doesn't matter what position you're in for sex. It doesn't matter whether the woman has an orgasm or not, and you don't need to lie down for hours and hours after intercourse to improve your chances of conception. Okay, so all those movies you see where they're lying there with their feet in the air and a pillow under their bottom, you don't need to. All right. Yeah, so I wanted to say this too. It takes time. So even when you do everything perfectly right and you time it beautifully, and we've got normal sperm and hopefully patent fallopian tubes, it takes time. So where the chance of getting pregnant each month is no better than 25%, and that's when we're probably in our younger years. So don't beat yourself up too much if it's not happening the first few months you try. You know, it takes time. I see people feeling really guilty that they haven't done it perfectly, and it's like, it just takes time sometimes. Okay, so I guess my summary to you would be to think about, try and become aware of your menstrual cycle so you know sort of how long it is. If nothing else, it will really help your doctors when you come to speak to us and we ask you how long that is, and you can say it's 32 days or it's whatever it is. Try and identify your fertile window, and some of those methods we've talked about might help you do that. And try and have sex if you can during that fertile window, and optimally sort of 1 to 2 days prior to ovulation. But if you've been having regular periods and you're still not pregnant after 12 months of unprotected sex, so no contraception, come and see someone. Or if you're over than 35 and you've been trying for 6 months, come and see someone then. Or come sooner if you're over 40, or if you've got a known fertility factor. So if you get really, really infrequent periods and only get 2 a year, don't wait for a year, come and see us sooner. Or if you've had treatment for cancer or any sort of medical problem that may interfere with your fertility, come and see us sooner for a chat. We're completely happy to give you some advice around that. And equally, if you've been trying the methods to see if you're ovulating and you don't think you are, you're welcome to come along and have a chat to us at the fertility clinic. We will sometimes do tracked cycles at the clinic just with blood tests, so we can determine whether or not you are ovulating, and hopefully, confirm that you are. All right, so I've got time for questions now, so I'm just going to scroll back up through here. So we've talked about sex. So like I say, no evidence that more sex is more effective than just having sex once a day or every second day. So someone's asking, if they had a positive ovulation predictor kit on day 16, is it okay to have had sex on cycle day 15 in the evening? Absolutely, because as we said, sperm will stay around for 3 to 5 days. Cycle day 16 in the afternoon, absolutely. So that's perfect timing. You're covering all your bases. That sounds really good. And then, yeah, so someone's asking, on an unmonitored letrozole cycle, didn't ovulate till day 17, is that okay? Absolutely, because as we said, that follicular phase will vary, and it doesn't vary between women, and it might vary within a woman. Each cycle might be slightly different. It won't matter that the follicles will be too big and not fertile, not at all. Remember, it's a bit different than when we're doing an IVF cycle. So when we do an IVF cycle, we want the follicles to get to a certain size before we take the eggs out. That's a much more different regime than someone who's doing letrozole or more in the natural state. So no, that's absolutely fine. But good questions. Any other questions for me? If my period is a 24-day cycle, then the rough date of ovulation, so if you take away 14, that would be day 10. So again, quite early on, okay? And it's really interesting, you feel like you barely finished your period and then you're ovulating, but that can certainly happen. So around about day 10 for you. So if you were doing the ovulation prediction kits, you'd want to start monitoring your LH levels earlier. So probably from about day 5, day 6, really, to see if you can get the ovulatory peak. Kat's asking, if your fertile window, should sex be every day or second day, or just as much as possible? Whichever you like. Daily, every second day, either is fine. It entirely depends on the couple as to what they prefer. So that's completely fine. What we, I guess, encourage is that you don't just have sex once a month, because if you time it and only have sex once a month, you might miss the right timing. Yep, periods can last 2 to 3 days. They can last 5 to 7 days. Everybody's very variable. We don't mind about how long the period lasts for. Obviously, if it's really heavy and painful, that's annoying for you, but it doesn't actually affect your fertility as such if it's a heavier period. And see your doctor, because there are some medicines you can take during your period to make it lighter if that's a problem for you. But it's more about how regular your period is rather than how heavy it is. Is there a way to check if you've ovulated without a blood test? Not reliably. So I should have mentioned, actually, one of the ways to confirm ovulation is we do a blood test 7 days after ovulation, or 7 days before your next period. And that's the one we're looking at for progesterone level, because that's usually at a peak by that stage. And if that level is checked and it's over 25 nanomoles per litre, we'd be pretty likely that you've ovulated that month. The only other way to check if you've ovulated would be to do a scan in that luteal phase and see if you could see a collapsed follicle with in the ovary, but that's probably a bit less reliable because people can have cysts and things anyway. So yeah, if we saw a collapsed follicle and it was about the right time, we would think you probably had ovulated. Oops, sorry about this. Is it normal that your menstrual cycle be affected after IVF? Yep. So the cycle after an IVF cycle can be different, and that's just because of the regime we've used and the hormones and stuff. So it might be heavier, it might be lighter, it might be shorter, it might be longer. That's nothing to worry about. It shouldn't then go on to affect your ongoing cycle after a few months. So I would just wait and see, give it a bit of time to get back to normal. So if you've been off birth control for 2.5 years, absolutely come and see someone. So, we count from when you stopped using contraception rather than when you actively started trying, okay? So absolutely come and see someone, particularly if you have another condition like polycystic ovarian syndrome. Yep, we definitely want to see you. Yep, theoretically it's possible to ovulate when you have your period if you have a very short cycle. That would be less common, but it certainly can happen. Yep, if you're one of those ones who has really longer cycles, longer periods. Yeah. What time of day is best to use the OPKs? I don't think there's a particular time. When I was doing it, or thought about doing it, I'd try and do it more in the morning because at that stage your urine is more concentrated. So if you're going to get a peak, you might see it then. And if you're one of these ladies who don't get a really clear peak, but you think ovulation is really imminent, then what you can do is to do the testing twice a day, so do it morning and night, but try and do it kind of roughly the same times each day so that you can be a bit more consistent. So yeah, if you thought it's coming up to day 13, 14, I'm really sure I'm ovulating, do it morning and night and see. Can I use the OPK to check if I've ovulated? It will just tell you, no, because the OPK is only going to tell you if you've had the LH peak. So we're assuming that if you've had an LH peak and the level LH has gone down again and you've got one line, that you'll ovulate. But it's not actually going to tell us that you've ovulated. You'd have to do a day 21 progesterone level to check that. Really good questions, people. I'm loving them. So the question's about using the OP on the 14th day. Okay, so for someone like you, if it's day 26, you could be ovulating around about day 12. Okay, so you probably need to start using your OPK kits earlier than that. So start day 9, day 10, because you might, it might be even higher before you'd gotten to that. So yeah, I would I'd test a little bit earlier. And I know some of those OPK kits are really expensive, especially the ones you buy in chemists. So if you get the ones online, they're often like $1 a stick. So then it doesn't matter how, you can do the testing a bit more frequently. Emily's asking if it's possible to have more than one follicle. Absolutely. Unlikely, less common if you're not using any form of ovulation induction like clomiphene or letrozole, but certainly is possible because that's how we get a lot of fraternal twins. Is it recommended to get a sperm check? Yes, so absolutely. So nobody's going to treat anybody until we've done some fertility testing. Okay, so it's pretty standard when you come along to a fertility clinic or your GP, actually, they'll ask you some questions and they'll get you to do some basic tests. So one of them will be a sperm test for your partner, and they'll think about doing an progesterone test possibly for you if your periods are regular. And then we would think about doing maybe ovarian reserve testing. So yeah, absolutely possible. We wouldn't do treatment without doing some initial investigations. Sorry, OPK is ovulation prediction kit. Sorry. So many terminology in infertility now. If my partner has a low volume sperm but high quality, is there a certain position or frequency? No, not really. Like I say, it shouldn't matter in terms of position or frequency. Sometimes for men who have a really low sperm count, we might say that, I'm talking about the men who probably need IVF and ICSI to help them conceive. For those men, we wouldn't suggest they ejaculated too frequently leading up to that IVF cycle or egg collection, and that's just because we might see fewer sperm then. But for a man who's got a normal sperm count, it shouldn't matter too much. And in terms of a low volume, that shouldn't make too much of an issue in regards to position or frequency. Possibly. So someone's asking about LH peak on day 16 and they had sex on 15, 16 and 17. If you wanted to have sex on 18, you absolutely could do, but it sounds like you've covered the bases anyway. So you've done really well. Excellent. So it does. So AMH stands for anti-Müllerian hormone test, and that is a measure of a woman's ovarian reserve, how many eggs she may have in her ovaries. And unfortunately, it's one of those tests that means that we do have a lower chance sometimes of getting pregnant, or it can explain why we're not getting pregnant so easily. But certainly you'll still hopefully still have ovulatory cycles, and so absolutely keep trying, because you've got still a chance of getting pregnant spontaneously if there's no other fertility factors. So even if our fertility treatments can't give you a very high chance, you've still got that chance of a spontaneous pregnancy yourself. Still more coming. That's good. Keep them coming. Does a low AMH mean that you cannot be pregnant? No. So AMH is just one of the things we use to assess someone's fertility. So it's also dependent on age and other fertility factors. So if you have blocked tubes and no sperm, then your chance of getting pregnant with a low AMH is incredibly low. But if there are no other fertility factors, then no, there's still a chance of pregnancy. Good question, Emily. So Emily's asking, does a high AMH mean you've got a better chance of getting pregnancy? And well, that's not the case either. So a high AMH is often associated with polycystic ovarian syndrome. And so those women are ones that may not ovulate spontaneously. And so they can get pregnant, but sometimes they'll need assistance with that as well. So it's not a either or. Yeah. So we use the AMH to decide on when we might do treatment, and also what dose of medications we'd use for treatments, if that makes sense. So it's more something that I wouldn't get too worried about it. It's more something that we use as fertility doctors. Oh, this Sarah, you've got lots of abbreviations now. Is EWCM egg white cervical mucus, maybe? Around what I believe is ovulation. Well, as I said, it's just one of the methods. So cervical mucus, I think that's what you're referring to. It's just one of the methods that might help you decide if this is the fertile window. Okay, so it will happen around ovulation, usually start before ovulation. So I would think it would happen before or just around ovulation. So you should be having sex around that time. And yeah, for some women, if they're getting those changes and they're noticing them, then it can be a reliable method. Jafali at 39, your AMH is 8.1, that's in the normal range. Yeah. I haven't got my, so low age and low AMH mean you cannot be pregnant. So if you're young with a low AMH, it means that you might have fewer eggs in your ovaries, but we'd be hopeful that they would still be of good quality. So even though they're fewer, they'll be of good quality because you're young. If you're older, then that can mean that that can be more problematic for you. So after a miscarriage, how long should you wait before trying? Really good question. So physically, you'll recover really quickly from a miscarriage. So if you were to get pregnant the following month, that is fine, and that wouldn't be a problem. But it's really up to the individual as to when they feel ready to start trying again. If you are wanting to try the next month, though, Oh, I see what you mean. You mean if you're still bleeding after a miscarriage? I guess you just have to, I'd probably judge it if your cycles were normally 28 days, then I'd probably start tracking at about day 2 weeks after. I thought, it's probably just, I'd be assuming I'd maybe ovulate 2 weeks after I started bleeding. It might be difficult for that first month just to know exactly, because as you know, when you have a miscarriage, sometimes your bleeding can go on a bit longer, or it might take a bit longer, but generally probably a couple of weeks later you might start be ovulating again. You can take a pregnancy test 14 days after ovulation. That's probably the earliest, and we try and make our patients wait till at least 14 days. Although having said that, I would be the one sitting there at 12 days after ovulation doing a pregnancy test going, I think I can see a faint line. You can do, but I wouldn't be worried if it was negative at that stage. I would do another one at least 2 days later, by day 14 to check. Yeah. So do what I say, not what I did myself. In this country, we don't put 2 embryos back very often anymore. So certainly publicly funded treatment, we only put 1 embryo back. We may consider 2 embryos of someone that had multiple embryo transfers without a pregnancy, or had no other options, but that's pretty few and far between these days. Good questions, people.
Thank you everybody for coming and for your all your questions. A recording of this evening's presentation will be available tomorrow on the news section of our website, or we'll also post a link on our Facebook page. So thank you so much, Karen, for joining us tonight and for presenting on this really important topic.
You're welcome.
And there's been lots of messages of thanks come through on the chat box as well.
Oh, nice. Lovely.
Great feedback. So thank you so much, and stay safe, everyone.
Yep. Thanks very much, Nicola.
Okay. Good night. Thank you.
Good night.